This program will focus on dog and cat diseases and the vaccines used to help prevent these life-threatening diseases. In order for us to understand how a vaccine protects an animal, we must begin with a quick look at the body's immune system. What is the immune system? The immune system is the body's defense against bacteria, viruses, and other potentially serious agents in the environment. It is a complex orchestration of living cells working in harmony to police the body for things that don't belong. For example, if a virus breaks in through the digestive system, within minutes the body sounds the alarm and trained infection-fighting cells are called into service to not only stop the invasion, but to prepare for future invasions by producing lots of custom virus-fighting molecules called antibodies. Vaccinating an animal is the process of introducing a substance into the body that will kick off an immune response that closely imitates the actual disease we are trying to prevent. The difference between the vaccine and the real disease is that the microscopic structure of the vaccine has been changed slightly, so as not to cause the severe disease symptoms we expect to see with the real disease. Vaccines mimic the real disease enough to start the body producing protective antibodies, but they don't have enough of the real qualities to cause the real disease. When we vaccinate an animal, it's as though we were conducting training exercises to prepare the body for the real assault should it occur. How can you expose a dog or cat to a serious virus in a vaccine without causing them to contract the disease? This is best understood by looking at the two major types of vaccines. One type is a killed vaccine. The other is a modified live vaccine. First, the killed vaccine. A killed vaccine means the actual disease-causing agent, for example the rabies virus, is treated with a chemical or heat to render the virus dead. Killed vaccines do not replicate and therefore require significantly more of the infecting agent or antigen in the vaccine to create an adequate immune response. With increased antigen, there is an increased risk of an allergic reaction occurring. The other type of vaccine, a modified live vaccine, is one that takes the actual disease-causing virus and changes it without killing it to make its disease-causing effect to be very mild. Much like taming a wild dog to be obedient, the process of taming the disease is called attenuation. A modified live vaccine, that is one that has been attenuated, will actually replicate once in the body just as it would in its wild form. As a result, less antigen is required in the vaccine. The modified live vaccine also has its drawbacks. It can produce very mild infection symptoms such as a low-grade fever. When vaccinating a puppy with a modified live vaccine, especially on its first exposure, always let the new owner know that their pet may be a little lethargic for the next 12 to 24 hours, but it's nothing to be alarmed about. A little lethargy is a low price to pay to prevent a life-threatening disease. The only other hesitation in using modified live vaccines involves pregnant animals or animals that have a suppressed immune system. With both of these groups, there is a degree of uncertainty regarding how well the fetuses or immune-suppressed animal can handle a live infection, even though the virus has been significantly attenuated. The advantage with this type of vaccine is that as the modified vaccine replicates in the body, it produces a quicker and longer-lasting immune response. How old does a puppy or kitten need to be before starting its vaccinations? Many people think if 3 vaccinations are good, then giving more would be better. As with other prescription drugs, inappropriate or too frequent use of vaccines may prove to be harmful to the pet. Vaccine side effects, though not common, should not be taken lightly. Your veterinarian considers these factors when selecting the right vaccination for your pet. During a puppy's first 24 hours, the nursing newborn is taking in modified milk called colostrum. This colostrum contains a wide variety of antibodies that are designed to protect the newborn for the first several months of life. These maternal antibodies, as they are called, protect the puppy for all the specific diseases the mother is protected for. Thus, a well-vaccinated animal will pass on to its offspring a form of temporary protection through the colostrum. The problem with vaccinating an animal prior to 6 weeks of age is that the vaccine tends to be neutralized by the existing maternal antibodies. This often leaves the newborn with reduced circulating antibodies and thus is even more susceptible to the actual disease. We want to time the administration of the vaccine to kick off a response just about the time the maternal antibodies are fading away, usually about 6 to 8 weeks of age. If we want to try to stimulate immunity in a young animal, we shouldn't vaccinate them for something they already have maternal antibodies for. Let's review the high points. Vaccines mimic the disease-causing agent, but are made safe by either killing the organism or modifying the live organism by attenuating it. This modified live virus is unable to cause the life-threatening symptoms, but is able to replicate in the body, stimulating antibody production. After repeated exposures, the animal has enough antibodies to fight the real disease.